My name is Matthew Belton. I'm a hand, wrist, and elbow surgeon at the University of Colorado. I'm also the associate program director for our residency program. I work with the athletic teams at the University of Colorado in Boulder. I think a lot of people will tell you, you don't really choose being a doctor, it sort of chooses you. It goes back to I think the Mr. Rogers quote in Mr. Rogers' Neighborhood, when his mom told him, if he was ever fearful, always look for the helpers. And I think that there's a lot of uncertainty today and in the past. And, something that gives you a little bit of calm is always looking for, the helpers. And, since, as a child, I've always sort of, been that person. I think being a physician truly exemplifies helping other, and that includes, children all the way to older people. And there's something that I get from it as much as the patients derive from it as well. So it's mutually beneficial. It makes my life happy, and it hopefully makes their lives enjoyable as well. So I think I love getting as much from the patients as they get from me. Patient care in hand is patient specific. I think it first requires an understanding of what is happening, but also how it may affect you. Certain things may not affect people the same way. So say you're a rock climber, you need to use your hand in a very different way than, say, myself, a surgeon, a person who's, in their later years, may not have the same expectations of their hand as, say a college football player. So really identifying the things that you want to do and the things that your pathology is preventing you from doing is first, it's important so that we can develop a patient-specific treatment plan for you. And that just requires a little bit of listening. In medicine, they usually tell you that patients will tell you the diagnosis. And so by giving the patient the time to express themselves, you're able to fairly quickly identify the diagnosis and really identify how much it bothers them, and which will inform how aggressive or not aggressive you need to be. I know it's a cliche, saying that we need to listen to patients, but I think in hand surgery, it's extremely important to really identify what's important to that person, so that you can help them get closest to there.